think you're going to play a little clip to begin with, right?
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.
So, in my capacity as director of the True North Health Center for the last 35 years, I have had a chance to see a lot of people recover their health. I've also had patients over the years age out and die. And I can absolutely say with 100% confidence that all of you will die. The only remaining questions are when and how. And when you're going to die is largely determined by genetics and luck. But how you're going to die can be profoundly affected by the diet and lifestyle choices you make. Anthropologists tell us that there's been 109 billion modern humans born on this planet, and that there's about 7.7 billion, more or less, of us alive today. And there's only been 5 people that have been well documented to live past 117. So no matter how you live, the chances of you living beyond 117 right now are about 1 in 20 billion. We can say that the chances are probably better than that you'll live less than 117. In 1900, life expectancy was 47 years old, and today it's 78. What's interesting is for the first time ever in the last 3 years, life expectancy has actually started to drop. What's interesting to look at life expectancy data, though, is that if you were 65 years old in 1900, you could expect to live an additional 12 years on average. And today, it's 19, which is a 7-year increase. And if you're 85, you can expect to live 2 years longer than they did in 1900. Well, if life expectancy is up 31 years, but adults are only living a little longer than they did in 1900, where's the difference? Where is that 24-year difference? Well, it's explained by a reduction in infant mortality. Because you see, in 1900, 160 babies per 1,000 died, mostly from waterborne illnesses and other issues. Today, we only kill about 6 of our babies per 1,000. So for every child that doesn't die in infancy, you add 78 years to the curve, it shifts the curve to the right. And in fact, of the 31-year increase in life expectancy, 24 of that 31 years is due to a reduction in infant mortality. It's not because adults are living so much longer. It's because we're not killing our babies because we have better hygiene, especially water protection. Now, many people think the problem is we just need to spend more money on healthcare. But if you look at the amount of money we spend per person in the United States compared to our colleagues in Europe and other places, you find we're spending 2.5 times more money per person, but we're not living longer. Our life expectancy isn't longer, it's lower. And we're not living better. Our healthy life expectancy is not higher, it's lower. So life expectancy is the amount of time a person can expect to live if they were born today on average. And healthy life expectancy is how much of that time is going to be spent healthy, fully functional. And for most patients that I talk to, their biggest concern is healthy life expectancy. They recognize that the maximum lifespan has limitations in terms of how much you can impact it. But what they don't want to do is spend an average of 9.4 years debilitated or 17 years in poor health. They don't want to find themselves unable to talk or move, lying in some nursing home bed, waiting for people to come and change their diaper. And fortunately, that healthy life expectancy is the thing that you can have the most profound effect on. Right now, we spend most of our money on treating the leading causes of death, which are heart disease, cancer, and stroke, instead of spending our money on the actual causes of death, the reason why people get heart disease, cancer, and stroke, which includes smoking, drinking, and eating an animal-based, highly processed food diet. One of the most effective ways that you can cause yourself to have premature death and disability is to smoke. Smoking is fabulous because it works on virtually every organ system in the body. It's not just lung cancer that you get from smoking. In fact, it's interesting that 80% of smokers will never get lung cancer. Isn't that interesting? I mean, how dangerous can it be, right? It's because people get heart disease and die from heart attack and stroke. They don't live long enough to grow their tumors. If you could make smoking just a little bit more toxic and kill everybody from heart disease, perhaps they could advertise it as cancer safe. High blood pressure has now become epidemic and is a major contributing actual cause of death because of its impact on cardiovascular disease. Alcohol consumption, isn't that interesting? That alcohol consumption is a major actual cause of death, but if you read the newspapers, you'd think alcohol was some kind of health food. They'll tell you, oh, you know, red wine has resveratrol, a powerful antioxidant. Where does that resveratrol come from? Yeah, the skin of grapes. But you don't hear them telling people, well, eat a few grapes. They tell you that alcohol thins the blood and reduces your risk for a clotting stroke. Is that true? Yeah. Yeah, it acts like aspirin to thin the blood. It doesn't actually reduce your risk of dying because, you know, you increase your risk of hemorrhagic stroke, bleeding stroke. But if it's important that you die from a bleeding stroke rather than a clotting stroke, by all means, imbibe. Another actual cause of death is elevated cholesterol levels, in large part because it's a marker of how much animal food you eat. The more animal food you eat, the more at risk you become. Being overweight, major actual cause of death. Low fruit and vegetable intake. Interesting enough, just not eating enough fruits and vegetables, perhaps in part because of the 2,000 phytochemicals that are found in fruits and vegetables, is an actual cause of death, as is physical inactivity, illicit drugs, and unsafe sexual behaviors. So these are the reasons why people are getting heart disease, cancer, and stroke, but this is not where the primary focus necessarily has been put. The epidemic that you'll see in most of the people that you know is metabolic syndrome. If you have 3 or more of these factors, your waist circumference is over 35 inches if you're a woman, or 40 inches a man, if you're have elevated triglycerides, if your blood pressure is elevated, if you have elevated blood sugar levels or a low HDL, if you have 3 or more of those, you have what's called metabolic syndrome. And if you have metabolic syndrome, you're at risk for a host of diseases listed here. And it's true, we are getting fatter as a country. In 1986, when I went into practice, there wasn't a single state in the United States that had over 14% obesity saturation. And today, every state has greater than that. In fact, many states are up there around 35% and climbing. And these numbers actually are underreported because these are self-reported weight measurements. And it turns out people lie. And they almost always lie underreporting, not overreporting for some reason. So 2/3 of people now are overweight or obese, even using conventional diagnostic standards. And what's of particular concern is a type of fat called visceral fat, which produces inflammatory markers and contributes to heart disease and cancer and diabetes and all kinds of other issues. One of those issues is diabetes. The incidence of diabetes is increasing geometrically. And what's interesting is that if you look at the correlation coefficients between increasing obesity and increasing diabetes, it's almost 1-to-1. It's almost as if there's some type of connection. So what we're doing about it as a society is trying to tell people to eat health food. Well, that's okay. I'll tell you what's on the slide. So health foods, you know what they are. Things like olive oil and red wine and dark chocolate and coffee and diet sodas and white meats and low-fat dairy products and dead Dr. Atkins diets, those kind of things. And health food, I don't think is the way to get healthy. I think we really should be talking about healthy foods. And healthy foods are fruits and vegetables and grains, legumes, nuts and seeds, a whole plant food, SOS-free diet. SOS, of course, is the international symbol of danger, and it also stands for salt, oil, and sugar, the chemicals added to food that make us fat, sick, and miserable. So more recently in the media, you've been hearing about fasting, particularly intermittent fasting. People like Walter Longo and others have done some fabulous research talking about narrowing the feeding window, just not eating, for example, at night after you have dinner and not eating again in the morning, so that you have a period of anywhere between 12 and 16 hours every day of fasting. Even that period of fasting, just that 12 to 16 hours, is enough to induce metabolic changes that's been associated with improving health, improving glycemic control or glucose control, reducing the recurrence of breast cancer in a study that was published in JAMA. So even these fasting mimicking interventions have been shown to be quite helpful to people, and they're things that people can do safely on their own. But what I'm going to be speaking about this morning is primarily medically supervised water-only fasting. That's the complete abstinence of all substances except pure water in an environment of complete rest. Water-only fasting in our facility ranges from 5 to 40 days. It's important to understand that not everybody's a good candidate for water-only fasting. In order to determine if you're a good candidate for water fasting, it does require a medical history. It's important to have a physical examination and also to have baseline laboratory testing done in order to be able to tell the difference between a healing crisis, a positive acute response of the body in an attempt to get well, and a problem. You really have to have some information in order to guide yourself. And that's why medical supervision with water-only fasting becomes an important issue if it's going to be safe and effective. There are many conditions where water-only fasting would not be appropriate. Pregnancy and lactation are rather obvious. If you were to water fast a lactating woman, she would lose her milk production. A condition called anorexia nervosa, which is a neurological condition where people pathologically restrain from eating. Type 1 diabetics don't do well fasting because you need a certain amount of insulin production in order to be able to adapt to the fasting process. If a person's had a recent stroke, myocardial infarction, pulmonary embolism, or DVT, fasting is a problem because until they've been stabilized after their condition, the physiological dehydration that occurs in fasting could, at least in principle, increase the risk of a clot. Cardiac instability, conditions like atrial fibrillation, particularly for those on anticoagulant therapy. Severe kidney disease, if the kidneys aren't functioning at a certain level, you really can't process the products of fasting, and that would become a problem. Genetic conditions like porphyria or MCAD, which is medium chain acetocoenzyme A dehydrogenase deficiency. It's a rare genetic defect where you can't break down fatty acids. These are patients that would not be fasted. If a person is cachexic or depleted, they have significant deficiency, obviously you'd want to replete them before beginning fasting. If you can't stabilize a patient off most medications, that's a problem because medications can become potentiated in fasting. And if you're not able to rest. Rest is very important in fasting because if you maintain normal activities during water-only fasting, what happens is once you've depleted your glycogen stores, your body still has baseline glucose needs, both by the brain and the muscles. And if you increase your muscle activity, what happens is that muscle activity will increase glucose needs. And the only place the body has to draw that fuel is from the breakdown of protein through a process called gluconeogenesis. And so it's important if we want to burn fat and not muscle that patients have rest during fasting. So conditions that are favorable to fasting include obesity. elevated blood lipids, high blood pressure, and type 2 diabetes, essentially metabolic syndrome, the condition that's affecting the vast majority of people in our society. It also turns out that there's evidence that fasting is effective in helping with autoimmune disorders. Autoimmune diseases are diseases where the body's immune system begins to attack itself. Autoimmune, self-immune. Cancers like lymphoma, gastrointestinal imbalances, this whole microbiome, there's 1,000 strain of bacteria living in your gut right now. There's about 5 pounds of bacteria. Think about that. You have 1 trillion cells, 5 pounds of bacteria living inside you right now, living, eating, drinking, and pooing inside your system as we speak. And what those bacteria poo inside you largely depends on what you feed them. So if you feed them meat, fish, fowl, eggs, and dairy products, you're going to get products including things like TMA, which becomes TMAO, trimethylamine oxidase, which is thought to irritate the lining of the vessels and contribute to heart disease and other issues. On the other hand, if you feed your bacteria soluble fibers, which are their natural food, then you get fertilizer and you make things like vitamin K and things that you need. So you want to make sure that your bacteria are pooing healthy stuff inside you, fertilizer, rather than toxic waste, and that's going to be dependent on what you put in your mouth. And also dependency and toxicity issues. For example, most smokers, by the second or third day of fasting, report no withdrawal effects, which is interesting. Now, some people say, well, yeah, they're probably so miserable fasting they don't even think about the cigarettes, but I don't think that's true. Fasting duration ranges from 5 to 40 days. Sometimes it will, average fast may be between 1 and 3 weeks, and sometimes it will take more than one fast to resolve a given condition, depending on the individual. Now, this is brand new, never shown this before, but we're very excited about this. There's a machine called a DEXA scanner, which allows us, normally is used to screen for osteoporosis. But with new software, these newer machines can also assess very accurately body composition, and including the amount of fat you have on your body, and in particular, and rather uniquely, how much visceral fat you have. That is the fat that's the central core fat that lines the abdominal area and the vessels, etc. So this visceral fat is impacted, as is subcutaneous fat, by fasting. But what's exciting in fasting, as you can see from this slide, is that visceral fat is selectively and preferentially mobilized in fasting. The ratio of visceral fat that's mobilized is almost 3 to 1 compared to subcutaneous fat. So what that means is, in this particular case, you have a 15-day water fast, and you see this individual loses weight, and they lose fat, and some of that weight loss is water and muscle, and some of that is fat. And then as they come off the fast, they regain muscle and water, but they continue to lose fat. So by the end of fasting, a significant percentage of their total visceral fat has already been mobilized, and their lean tissue is minimally lost. So what this is suggesting to us is that not only is fat predominantly lost in fasting, but particularly visceral fat. And so given this evidence, what we're doing now is we're going to embark on a large-scale study which will actually analyze large numbers of people and take a look at this. But what we've always known is that water fasting tends to go to the tissues that the body perceives to be a biggest risk. For example, let's say you lose 10% of your total body weight during a fast. You'd expect then maybe you'd lose 10% of your breast tumor. But no, that's not how it works. Sometimes the entire lesion will disappear, even though not proportional to the percent body fat. The body has the ability to go in there and do some excuse me, rather amazing things. Another condition that's primarily impacted by water-only fasting is high blood pressure. High blood pressure and the conditions associated with high blood pressure are actually the leading contributing cause of death and disability in industrialized societies. For example, almost 6 million people will develop congestive heart failure maybe 287,000 will die from it. And blood pressure is the major contributing factor for congestive heart failure. 800,000 people or more will have strokes this year. Again, high blood pressure, major contributing cause. The fact is, most people will develop high blood pressure during their lifetime. Almost everybody you know will end up with high blood pressure. 40% of people over age 25 and 63% of people over 60 today have high blood pressure. It's the leading justification for prescription medication. It's worth billions of dollars to the medical industry. But the majority of people that have heart attacks and strokes don't have blood pressure high enough to justify medication. In other words, why don't they just give everybody blood pressure? Why don't we put it in the public water supply, for God's sake? I mean, if it's so common. And the reason is the drugs that are used to treat high blood pressure are very dangerous. And if you give somebody blood pressure medications that doesn't have a certain level of high blood pressure, a higher percentage of those people will die from the medication than from the blood pressure. So you have to have blood pressure high enough in order to justify the risk of the medication. For example, if your blood pressure is 138/88, you have 5 times the risk of a heart attack compared to somebody at 110/70. But the risk of taking medications would exceed the benefit at that level. So what's also interesting is for every point you drop your systolic blood pressure through diet and lifestyle changes, you reduce your risk of all-cause mortality 1%. And that level may go down as low as 90/60, according to some researchers. So even at 120/80, you can further reduce your all-cause mortality by continuing to make diet and lifestyle changes. And actually, most patients do end up much lower than that if they persist with this diet and lifestyle change. But that's how we treat blood pressure. 1 medication, 2 medication, up to 5 medications. And the results are very disappointing. The other thing that's unique about blood pressure is if you go to the doctor, they will tell you, take these drugs, and you'll be on these drugs for how long? For the rest of your life. Now, how does the doctor know that you'll be on the medication for the rest of your life? Because they can guarantee you that you will never recover. You will be sick forever and be on these medications for the rest of your life. And according to a quote that I drew off the CDC website, it said, unfortunately, people with hypertension cannot be cured because there is no underlying cause for the high blood pressure. There is nothing that can be fixed to resolve it. And that's actually true in the sense that there is no pill or potion that's going to cure blood pressure. What's not completely true is that we don't know what causes it. The fact is, if we want to look at the different things that have been shown in meta-analysis, that is, large studies that have been analyzed, we know weight loss helps with blood pressure. For every kilogram of weight you lose, there's a 1.6 point drop on average in systolic blood pressure. We know that vegetarian high-fiber diets, independent of weight loss, are effective at reducing blood pressure, and that not drinking alcohol is a major risk factor for high blood pressure. Just not drinking alcohol reduces blood pressure on average 4.8 points. Exercise is an effective strategy for managing high blood pressure. And although drugs are effective at lowering blood pressure, an average of 12 points, they come at a cost. The cost includes chronic cough, fatigue, impotence, and premature death. Aggressively reducing sodium, in other words, using an SOS-free diet, a salt-free diet, a diet that doesn't have added salt, thank you, will reduce blood pressure an average of 16 points. If you just take your whole plant food diet, you're going to get anywhere between 300 and 500 milligrams of sodium, which is enough to meet all your needs for this critical and essential nutrient. If you use any type of processed foods, of course, that number goes up significantly. But by reducing sodium to 0.5 milligram of sodium per calorie, you can get a really significant drop in blood pressure. John McDougall did a program where he combined those variables at the St. Helena Hospital and got an average of 17-point drop. And T. Colin Campbell from Cornell University worked with us on a study that we published with an average drop of 37 points. Oh, that's good. Let's go forward. And we published that study. That was the first paper that our research group was able to publish, medically supervised water-only fasting in the treatment of hypertension. We took 174 consecutive patients with high blood pressure, and interestingly enough, 174 people achieved low enough pressure to eliminate the need for medication. And for those with stage 3 hypertension, that is, their systolic blood pressure started at an average of 180 milligrams, 180 points, they were able to drop their blood pressure an average of 60 points. Now, that's taking their blood pressure, in many cases, on medication, and in all cases, these people were off medication by the time we were finished. So it's 60 points plus whatever effect the medication might have been having. That represents the largest effect that's ever been shown in the scientific literature in treating high blood pressure in humans, doing essentially nothing, which is water-only fasting in a supervised setting. If their blood pressure started off more moderately, say 166, they dropped their blood pressure proportionally. We published a second paper in JCM, which was the treatment of borderline hypertension. That is, people that were at risk from their blood pressure, but not high enough risk to justify the risk of medication. And of course, their blood pressures dropped proportionally. After we published these papers, we were approached by the International Union of Operating Engineers, one of California's more powerful labor unions, and they said they were interested in offering our program for their members because they were spending millions of dollars in treating blood pressure elevations and diabetes. And we presented our information. That was interesting at a meeting. Dr. Lyle, our clinical psychologist, and myself went to a meeting. We presented our data, and they had representatives there. They had an NIH reviewer there who reviewed for the National Institute of Health. There was a actuary that calculated the costs of everything. They had representatives of the union as well as the contractors. And after we presented our data, the contractors' representatives were objecting to the costs of adding an additional program like ours to the benefit. They thought that they spent enough on health care as it was, and they didn't think sending people to a resort was going to help them too much. Then I described a little bit about what happens when you go through fasting. You know, the low back pain, the nausea, the skin rashes, some of the other interesting symptoms that come up. And after a while, they decided maybe it wasn't really a vacation, but they still objected. But the NIH reviewer said he'd reviewed our data and he thought that it would actually result in a cost savings by getting people healthy. The most interesting thing to me was the actuary who had done a bunch of calculating during our presentation. You could see him writing his numbers. And you need to understand that union members, if they live long enough to retire, get a monthly pension benefit. And he said, Dr. Goldhamer, if we do this program and it works, won't it dramatically increase our costs of retirement payouts by making them live longer? I know. I didn't know what to say. Guy stood up. I knew he was a crane operator because his neck was like twice as big as my thigh. And he said, listen, little man, you should remember who you work for. He said, you work for us. Why don't you calculate how much money we're going to save when I come back there and break your neck? And then they voted unanimously to make our program a fully covered medical benefit for any member of the union or their family that had high blood pressure or diabetes. And they asked us to do a study to see what would happen, and we did. And we took the first 30 consecutive members that they sent us who underwent a 3-week stay. They lost 26 pounds on average, and at follow-up they were down about 28 pounds, which means they'd maintained much of their improvement. Their systolic and diastolic blood pressures had also maintained, and they saved more money in the first year than the entire cost of the program, largely because of reduced pharmacological and hospitalization costs. And so they went on for over a decade. We worked with this union and treated over 100 of their members with diabetes and high blood pressure. I always remember, though, the very first gentleman they sent us. They made this program a fully covered benefit, so there was no expense to the member. They sent us a gentleman whose blood pressure was 240 over 120, capped out on 5 medications, but they didn't tell him what the program was. They just told him to come to this place, and he thought he was going to get what? Another drug, yeah, you know. And he showed up, and, you know, he had a huge belly on him, and he was looking around. And he said he thought he was in the wrong place. I said, no, I got your name's on the list here. You're in the right place. He goes, no, I don't think so. I said, you're here to get well. He says, well, it's not me. I'm not sick. Of course, then I'm a little pissed. It's like, what do you mean you're not sick? Your blood pressure's 240 over 120. You're capped out on meds. You got a keg on your belly. I said, not only are you sick, you're going to die. And he said, well, aren't we all going to die? Valid point. So I thought, okay, different tact. I said, look, you're taking $880 of medication each month. If we get you off all those drugs, you'll save a lot of money. And he said, what do I care? I don't pay for the drugs, the union does. So at this point, I realized this is not my normal self-selected, highly motivated patient. I'm trying to think, what am I supposed to do now? It's my first guy. I don't want to, And of course, I'm thinking about his medical history, and what do we know about males, particularly that have diabetes and hypertension? Yeah, so I thought, huh? I said, if we get you off all those drugs, we may be able to do something about your little problem. So when he stood up, I was starting to think that wasn't such a good idea because he was a pretty big guy. He said, well, why the hell didn't you just say so? So we're, thinking, okay, got his attention. And he was telling me about his diet. And this was his diet. Except I couldn't get a picture without that nasty green stuff at the top there. He said if they made a mistake and put that on, he would take that off and throw it away because he didn't like that green stuff. So I know before we started fasting, we had to try to get some real food into him. And so we gave him some food. And, he tried to eat it, but he was like, I'm thinking maybe we missed, maybe he's got a big tumor we missed or something. Can't seem to swallow the food. So I sat down next to him. I said, it looks like you're having trouble with the food. And he said, what food? He said, this is not food. He said, this is disgusting. He said, if I have to eat tasteless swill like this the rest of my life, I'd rather just die. He said, why don't you go out to my truck and get my 12 gauge when I'm not looking? Just shoot me in the head. So we checked him in. Make a long story short, he had a 26-day water fast. He lost almost 50 pounds. He normalized his blood pressure, his blood sugar levels. And afterwards, we were giving him the same food again, only now he was actually eating it. When I sat down with him, I said, it looks like you're doing better with the food. He said, yeah, you damn chef's finally getting the hang of it. Took me 20 minutes to convince him it was the same food. He said, no, that stuff you gave me when I came in was disgusting. He said, this stuff's not bad. So the question is, okay, blood pressure normalizes and things improve, people lose weight, they lose visceral fat, but is it safe? Is it really safe to put a person on a water-only fast for periods up to 40 days? And so to answer that question, we did a study. It's called a safety study, where we took every patient that underwent this protocol for 5 years and analyzed every patient, every symptom, every day, and then used an accepted standard in order to come up with the results for this paper that was published in one of the peer-reviewed journals. And the common terminology criteria for adverse events from the National Cancer Institute was the standard that was used. And that means every patient's symptom every day has to be categorized into these 5 grades: mild, moderate, severe, life-threatening consequences, or death. So if you have a mild symptom or symptoms that day, they'll get categorized as a Category 1 adverse event, et cetera. We had 5,949 total adverse events in all of the patients that underwent fasting during that period of time. There were no Category 5 events, so nobody died. There was one Category 4 event. This actually was a case of what's called hyponatremia. The sodium levels went low. We had to realiment this person with added sodium in order to bring their salt levels back to normal. They did fine. 310 Category 3 events. Interestingly enough, a third of those were what are called hypertensive crises. A hypertensive crisis is any time your systolic blood pressure goes over 160. So you might ask, well, why would 100 or more people have blood pressure over 160 if they're fasting, since fasting is used as a treatment for high blood pressure. So the way this works is, any day your blood pressure is over 160 is considered an adverse event. So if a patient comes in and their blood pressure starts at, say, 220, and the next day it's 200, and the next day it's 190, and the next day it's 180, and the next day it's 170, each one of those days is an adverse event, okay, even though clearly it's coming down. And so that's where those Category 3 events came from. Category 1 and Category 2 events are the symptoms we expect to see in fasting: low back pain, headache, nausea, all kinds of detox symptoms that are annoying but not threatening. 95% of adverse events are considered mild to moderate, and the conclusions of the study were that most of the events are not only mild and moderate, but they're the ones we expect that are known to occur during fasting, that there's a slight correlation between the numbers of adverse events and aging, but no correlation between the severity of events and aging. And this was very important, because until this study was done, nobody over age 65 could be allowed to fast in an approved study, because there was no safety data suggesting that it was safe. So if you were 65 or older, you were too old to be able to go through this process, supposedly. Now we know that there's no more chance because you're 75 than if you're 35 of having a serious event, and as a consequence, people are able to fast with a broader age range. And as the True North Health Center's protocol has been shown to be safe. So how is it possible that doing nothing, like fasting, could have a bigger impact on the leading contributing cause of death and disability than just about anything that's been shown? What percentage of people do you think that do water-only fasting lose weight? I know that sounds kind of quacky, doesn't it? 100% effective. But we know from the laws of physics and thermodynamics, if you don't eat, you're going to lose weight. Although I did have a patient one time who said that she wouldn't lose weight. So what do you mean you won't lose weight? She goes, no, she's been on all kinds of diets, she never loses weight. I said, so you're going to violate the laws of physics and thermodynamics? And she said, yeah. So she went on a fast. First day, what happened? She went up a pound. She was so excited. She felt vindicated. She said, see, Dr. Goldhamer, even water fasting, I gain weight. So she held a little fluid that day. She ended up losing a pound a day just like everybody else. Average weight loss is about a pound a day. And as we know now from the slide I showed you previously, we know that the net effect is going to be mostly fat loss, and in particularly visceral fat. Natriuresis is the selective elimination of sodium that accumulates in the body. And sodium is a real problem, because excess sodium causes increased blood volume, which increases blood pressure, which is why people eating salt have a higher problem with blood pressure. It also causes edema and swelling, and not just conditions like congestive heart failure, but also it makes your arthritic pain and joint pain worse. It causes wounds not to heal. It stimulates passive overeating, so results in obesity and other problems as well. But this excess salt is selectively mobilized early on in fasting, and that's why you'll see people lose actually significant amounts of weight, which is mostly water initially, because of this excess fluid that's been retained to neutralize the effects of the sodium in the body. Detoxification. Are people really toxic? Is that true? If you took a fat biopsy of people, would you find several hundred different chemicals in various concentrations? Things like PCB and dioxin and pesticide residues and heavy metals, etc. Yeah, it turns out we're accumulating these. In fact, the single biggest source of toxicity for the average person, besides drugs and those types of things, is actually their diet, and in particular eating animal foods. It turns out that animal foods biologically concentrate the toxins from their environment, from their feed, from their treatment, and it builds up day after week after month. So when you eat an animal, you get its entire lifetime accumulation of toxins. In fact, if you look at it calorie by calorie, if you look at a calorie of plant foods and a calorie of animal foods, that animal food could have anywhere from 2 to 1,000 times the concentration of various chemicals, because of this concept of biological concentration. And in fasting, the body rapidly begins to mobilize and eliminate these toxic products. In fact, some authors have suggested that you should never fast, because the fast is so efficient at detoxification, it will overload your body's ability to keep up with it. Unless you take their proprietary products, then of course, then apparently it becomes safe. But that's not been our experience, of course. The body's well equipped to do fasting. Fasting is actually a biological adaptation. Humans had to be able to fast because our huge bulbous neuronal nets at the end of our spinal column called the brain is a big burner of glucose. It's our biggest burner of glucose, a major burner of energy. And so if humans with our huge brains didn't have the ability to fast, we could never have wandered away from the tropics. We'd be like other primates that you never see leave the primates because they need constant source of fuel because their brain doesn't convert to burning fat. It just burns glucose. Humans have this adaptation where we can burn fat, so the average, even a thin male can fast up to 70 days. So it allowed us to wander away from the tropics and survive. If not, the very first time spring came late, all the humans would have died. In fact, that's probably exactly what happened, which is why today humans, as a part of our genetic characteristics, have this ability to fast. And all we've done is taken this very natural ability and used it in a very abnormal, unnatural circumstance. And that's a circumstance where people are getting exposed to dietary excess. It doesn't really happen in a natural setting. Fasting also induces enzymatic changes. Like, have you ever wondered, like, if you want to burn fat storage, how does that happen? Well, it happens through a process called lipolysis, which is enzymatically driven. And when you go on a fast, you induce those enzyme systems of fat mobilization, including visceral fat mobilization. And what's interesting is even when you're done fasting, you're still more efficient at inducing fat mobilization than you were before fasting. It's very much like athletes become more efficient at mobilizing glycogen stores. You know, that's why they go through carb loading and training. They get better at utilizing their glycogen stores and mobilizing those because they induce those enzyme pathways through their vigorous activity that induces them to change. And those enzyme systems persist after fasting. So you're not just more efficient at mobilizing glycogen and fat during fasting, but after fasting, and every time you fast, it appears to be cumulative. And it's not just endogenous enzyme systems, but also exogenous. How do you think you get those toxins out of your body? Most detoxifying pathways are enzymatically driven. So when you go on a fast and you begin doing this detoxification process that can make you kind of feel miserable, those enzyme systems also appear to persist. And so you'll continue to detoxify more efficiently weeks and months after you've completed fasting. And in fact, that may be one of the mechanisms why intermittent fasting may be helpful, even that 12 to 16-hour period that you can do every day, because it may induce some of these changes that cumulatively persist. And so when people fast, they detoxify, and after people fast, they are more efficient detoxifiers. Insulin is a hormone, and it drives sugar from your bloodstream into your cells where it's needed to burn as fuel. What would happen if you couldn't drive your sugar into your cells and the blood sugar levels went up? What would we call that? Yeah, that's what diabetes mellitus is a condition. It's not an insulin deficiency. Type 2 diabetics actually make more, not less insulin. It just doesn't work. It doesn't work because there's something called insulin resistance. There's resistance at the cells to accepting and utilizing the insulin. What causes insulin resistance? Well, it's not just fat, but more specifically, the diet that makes you fat. Now, why do I say that? Well, if you're overweight and have insulin resistance, do you have to lose all the fat to start improving your insulin resistance? No, the day you change your diet, you start to see objective improvement in insulin resistance, as soon as you stop doing the things that cause it. Now, it's true, you will lose weight, and over time, you'll lose weight all the way down to your optimum weight, and you will get improved insulin function. And that's why type 2 diabetics that do diet and exercise oftentimes can improve their condition, sometimes dramatically. And with fasting, that process happens even more quickly. So you have a tunnel through your body. That tunnel starts in your mouth, and it goes down the esophagus. Yep. And then it gets to the stomach, and then it goes through the small intestine, and it goes through the large intestine, and then eventually ends up down in the rectum, and then there's a hole at the end called the anus. And so digestion is essentially shoving things in one hole and then later trying to push it out the other. But nothing has been in the body unless it gets absorbed through your intestinal mucosa, represented here like a screen. Now you notice the holes. If the holes are smaller than the fly can't get through, can it? And the same thing's true in your body. When you swallow something, it does not enter your body unless it gets through the intestinal mucosa. And that mucosa is so small that, for example, even a protein molecule is too big to get through it. An amino acid can get through, a protein can't. And so that membrane filters things, so you're only absorbing the stuff that you need. But what happens in the intestinal mucosa is the same thing that would happen with your screen. What if the screen becomes damaged? Can the flies get through? Yeah, and in your intestinal tract, if you have inflammation that causes damage, stuff can leak through. They call it gut leakage. So what might cause gut leakage? What could cause inflammation? What could you do to cause inflammation in your system? So any source of free radicals, like what's the best source of free radicals? Free radicals are reactive, O3, reactive oxygen molecules that can damage tissues. How about smoking? Do you think smoking causes free radicals? Could you tell which is the smoker? How could you tell? So wrinkles are cross-linked collagen tissues that come from free radicals. It's a facilitated part of aging. Smoking literally just speeds up the aging process, so you get that really highly attractive wrinkled look, which is, I assume, why people smoke, because they're looking for that. Now, do you think smoking just affects their face? No, it affects all the tissues in the body, including the animal lining of the blood vessels, which is why only 20% of smokers will get lung cancer. Because they get that damage to their blood vessels and they get that heart attack, 80% will never get lung cancer. In fact, you could almost say that smoking is protecting them against lung cancer by killing them from heart disease. Yeah. But what if you didn't want to smoke because it's so disgusting? What else could you do to bathe your body in free radicals? Drink alcohol, absolutely, including red wine, including organic red wine, okay? Because alcohol, the peroxidation of alcohol yields tons of free radicals. For example, why do you think alcoholics get cirrhosis of the liver? The cirrhosis of the liver, that fatty lymph infiltrate, is a scar tissue that results from the liver having to detoxify the nasty effects of alcohol. So but what if you didn't want to smoke and drink? How about eating oils, particularly heated oils, and foods cooked with oils like breads and crackers and cookies and basically all the stuff that you find in the grocery store packaged up in various forms? Excellent source of free radicals. Another thing fasting does is it reboots the autonomic nervous system. The autonomic nervous system is the part of the nervous system that controls the things you don't think about. For example, if you were to go out running and your heart didn't speed up, you wouldn't get enough blood flow and you'd die. Did you ever die because you forgot to tell your heart to speed up? Do you always remember to do that? How does it know to do that? It's the autonomic or automatic nervous system that controls that. And the autonomic nervous system has two parts, the sympathetic and the parasympathetic, and they work in contrast with each other to keep each other balanced. So, for example, if your sympathetic nervous system tone is too high, you might have a problem like constipation because the autonomic nervous system controls peristalsis. Or if the parasympathetic tone becomes too high, you might have diarrhea. So balancing out the autonomic nervous system turns out to be an important issue. In fact, we've discovered literally hundreds of different systems that work on the autonomic nervous system. Have you ever wondered, how does massage, biofeedback, meditation, yoga, acupuncture, homeopathy, herbal therapies, chiropractic manipulation, osteopathic manipulation, how do all these things actually make people feel better? In large part, it's because of the effect on the autonomic nervous system. But the most powerful method I've ever seen to normalize the autonomic nervous system, it works like if you have a corrupted hard drive and things aren't working and you reboot the hard drive, you don't know why, but it kind of clears everything up and starts working again. That's essentially what happens in fasting. It's like rebooting the internal mechanisms of the body and rebalances the autonomic nervous system. Isn't it interesting? You've got all these religions in the world, right? The Jews, the Jains, the Hindus, the Muslims, the Christians, all these different, they're killing each other in the street. They argue about so many different things. But they do have one thing in common, and that's a respect and recommendation of fasting. So every major religion has this tradition about fasting. They talk about it for spiritual reasons. They talk about it for health reasons. And there's probably a reason for that, because when people fast, it changes the way they think about themselves and the world around them. The immune system, and particularly autophagy, the body's ability to go in there and eat up broken down or damaged cells or cancer cells, is not suppressed but rather enhanced during fasting. And we know this because you can measure all kinds of indicators of immune system function, helper, killer T cell activity, neutrophil phagocytosis, et cetera. These all tend to be enhanced during fasting, including lysosomal activity, which is how intracellular debris is cleaned up. I would suggest that we know the cure of cancer, and the cure of cancer is prevention. So the real secret's going to turn out to be preventing cancer before it forms. And the way the body prevents cancer that it's being exposed to probably every day is through this immune system function and autophagy, and it is enhanced during fasting. And taste neuroadaptation. The idea that, one of the biggest challenges in getting people to eat a whole plant food, SOS-free diet is people are addicts, and they're addicted to the artificial stimulation of dopamine in their brain, which we call the pleasure trap, from taking chemicals added to their food, including salt, oil, and sugar. So to get people to tolerate food, like my union member, who thought it was disgusting, tasteless swill, fasting is a really useful tool, because after fasting, good foods taste good. You can do the same thing with diet over enough period of time, but it takes about a month to adapt for the average person to a low-salt diet, and it can take as long as 3 months to get satiation on a low-fat diet. So you have to have some patience. And so people that say, well, I tried that diet for several days, but it didn't resolve my lifelong problems, isn't necessarily a valid criticism. We actually completed a study on taste adaptation. What we did is we figured out how to quantify minimum perception to things like salt and sugar. And so we tested people before, during, and then after fasting. And we did this both with objective measures and in the laboratory, but also hedonic measures of surveys. And what we found was that there is increased sensitivity to salt and a decreased liking of salty, fatty, and sweet fatty foods as a result of fasting, which may be why many of our patients that had trouble complying with the diet before fasting now find that they can get satisfaction from the diet and no longer feel like that it's tasteless swill. This is just a summary chart of things that we know increase in fasting and decrease in fasting. We know that glucose and insulin decrease, as IGF-1, which is insulin growth factor 1 associated with aging, also decreases. Leptin, blood pressure, heart rate, mTOR, as well as the microbial load. Inflammatory markers go down in fasting. And essentially all of the abnormalities associated with metabolic syndrome. And we know that some things like satiety mechanisms and beta-hydroxybutyric acid, which increases BDNF. BDNF is brain-derived neurotrophic factor. This is the thing that's thought to protect the nervous system. Insulin sensitivity increases. Cellular stress, resistance, and adaptation. That was an interesting study Walter Longo did where he took rats that had cancer in matched groups. And the 30 rats that had cancer, if you give them enough chemotherapy to get rid of all their cancer cells, all the rats die. So why do they have to get rid of all the cancer cells? Why can't they just get rid of most of them? Because it comes back, grows back. If you give enough chemotherapy to get rid of all the cells, the host dies, which kind of defeats the purpose. On the other hand, he took the same rats with the same kind of cancer and used fasting before, during, and after that exposure to chemotherapy, and all 30 rats survive and had dramatic increased survival. Because fasting, it turns out, protects the healthy cells and it makes the cancer cells more vulnerable. Cancer cells don't have as much mitochondria, the energy-producing mechanisms. They have a higher metabolic rate. So in an environment without glucose, they have a selective disadvantage, which makes them much more vulnerable to traditional chemotherapeutic interventions. And so that's now being used in increasing ways with humans. And again, we mentioned gut diversity. You have about 1,000 strain of bacteria in the healthy gut of a human being, and fasting helps reboot that. What's interesting to note is that many of the markers that improve with fasting are the same markers that improve with exercise. Brain-derived neurotrophic factor goes up with fasting, with exercise. So do many IGF marker reduction, both fasting and exercise. Now, why would fasting, where you're resting, do the same kind of thing to the body as exercise, where you're vigorously mobile? That's not intuitively obvious, is it? Unless you realize that what does fasting and exercise have in common is they're both undoing the consequences of dietary excess. Fasting and exercise are undoing the consequences of dietary excess. And I'm going to suggest that for most of these diseases, particularly metabolic syndrome and all the related conditions, it's dietary excess that's the driving force behind that. And anything you do that reduces dietary excess is likely to be helpful. And the reason fasting seems to be the most helpful is because it's the most effective at dealing with the consequences of dietary excess. According to Walter Longo, the combination of fasting and chemotherapy results in dramatically higher cancer-free survival than chemotherapy alone, published in the Journal of Metabolism, 2015. So I'd like to share with you a few case reports, what actually happens with real people when they go through fasting. And this patient was a 41-year-old female who'd been diagnosed as follicular lymphoma. This is a type of cancer involving the lymph system. This is a particularly interesting cancer for us because there is no effective medical treatment, and so watchful waiting is considered reasonable, not unethical behavior. And as a consequence, this particular patient had been tracked for 2 years by her family physician, and it got bad enough and she became symptomatic enough that he recommended that she go to the med school for chemotherapy. She asked her doctor, was there anything she could do to slow down or reverse the process? And he said no. She said, what about diet? And he said, no, diet is not related to lymphoma. And she said, what about fasting? And he said, well, that's criminal quackery. So she went to the oncologist. The oncologist also told her that there was nothing that she could do. Diet was not an effective treatment for lymphoma, and there was no reason to think that fasting would be of help to her. So now this patient had been very carefully diagnosed. She had her CT-guided biopsies. There wasn't any question about her diagnosis. So given the tremendous medical encouragement, she came to the True North Health Center, where she underwent 21 days of water-only fasting, during which time her tumors disappeared. So we could no longer feel any tumors. She did 10 days of refeeding, and we sent her back to the medical school with some very specific instructions, because we knew we needed to get a follow-up documentation. During the 21 days of fasting, she'd lost 22 pounds, and she resolved her masses. Now, when she went back for her follow-up, the doctor examined her, and he looked at her chart, and then he examined her again. He looked at her chart, and he looked at the picture, and he looked at her, and he said, what happened? And she said, well, I went to the criminal quacks, and I did the fasting, and the tumors disappeared. And he said, my, I'll have to give them a call. And then she said, I'd like to have a CT scan. Then he got a little nervous, and he said, no, you don't need any CT scans. And she said, but she'd like to objectify the change. And he said, you don't need to objectify the change. I've been in practice 25 years, and I'm telling you, you don't need any CT scans. And then she said, well, what if there's cancer lurking just beneath it? And he said, okay, fine. So he ordered a CT scan, told her that because her white count was still low, perhaps she should have some gentle chemotherapy. And she refused and said, maybe we should watch and see what happens with the dietary change. At 6 months, well, first of all, you notice she went from 152 pounds. At 2 months, she was at 139 pounds. How did that happen? She followed the whole plant food SOS-free diet, continued to lose weight as expected, down to her optimum weight. At 6 months, she was at 138 pounds, and her white count was entirely normal. When she went back to the oncologist, he agreed that she was better now, told her to come back at 12 months, which she did. And so at that point, we decided maybe it was time we should try to write this case report up. So we wrote this report up. I called my colleague John McDougall up. I asked him what he thought about us submitting this case. He said, yeah, that was a good idea, since we had objective evidence. And I said, I thought maybe we'd send it to the British Medical Journal. He suggested that probably wasn't going to work because they weren't going to publish. It was too big of an impact journal. Sent it to one of the smaller journals who'd have a better chance. He said he had submitted an article there, rejected it. He wasn't too happy with them. So given that sage advice, I, of course, immediately sent it to the British Medical Journal. And after some back and forth, they did actually publish that paper. This was her CT scans before and after. And that was the paper that came out. Water-only fasting and a exclusively whole plant food diet in the treatment of follicular lymphoma. But they said, look, a small percentage of people go into spontaneous remission, so could you follow this patient for a number of years and then submit a follow-up? Because maybe it was just luck. So we said fine, and we followed this patient for 3 years, during which time you'll notice that at 3 years she was 136 pounds. So what had she been doing? Following a whole plant food SOS-free diet. I had told her that she needed to follow a whole plant food SOS-free diet or it could be fatal because I would track her down and kill her. And apparently she believed me because she did stick to the diet, at which time whole body CT suggested there was no evidence of pathology. So we submitted a second paper to the British Medical Journal, which was immediately rejected by a reviewer that said, oh, she's probably just lucky. But we did appeal, and they did ultimately publish this follow-up as they had invited us to submit. And now I'm happy to say we just got a 4-year follow-up on a woman. She continues to be both compliant and healthy. So this next case report it was a dentist that came to us. She had been at a dental convention, got hit in the head by a pole, developed a dural tear, and had, as you can imagine, a headache. But in her case, the headache didn't go away for 16 years. So she'd had constant daily head pain, 8 out of 10 or higher, every minute of every day for 16 years, despite trying Neurontin and drugs and seeing various neurologists. So she was pretty desperate. She'd become disabled, and she came to us to do fasting. And so we agreed to fast her for 40 days to see what would happen. And the first 19 days, she had no relief at all. She had constant daily head pain. On the 19th day, she said she woke up and for the first time in 16 years had woke up without a head pain. It lasted for almost 5 minutes, and then the pain came back. And we continued this fast of 40 days as planned. And by the end of 40 days, she was largely better. She wasn't having any acute pain. She had a few prodromal symptoms. And we went to break her fast, but she insisted on fasting one more day. And I said, why do you want to fast one more day? And she said, because the men fast for 40 days. Moses, David, Elijah, Jesus. And she said, women always have to do just a little more. And so we let her go to 41 days. And then we refed her for 6 months. We rebuilt her. And during this time, she didn't have any severe headache, but she had some prodromal symptoms. She was still not quite right. And so after 6 months, we reinitiated another period of fasting for another 40 days. And at the end of that second 40-day fast, she was out of pain. And we published a paper with a 6-year follow-up. She'd had 6 years without pain. And this was a challenging case, clinical practice, long-term relief from chronic post-traumatic headache after water-only fasting and an exclusively plant foods diet. I'm happy to say we now have an 8-year follow-up on this patient. She continues to comply and be healthy. So this case report was a case of non-pharmacologic, that is no drug, management in a case of uncomplicated subacute appendicitis. So this gentleman came in, was told he needed surgery to remove his appendix, which I think we heard yesterday may actually have some utility. But rather than go through the surgery, we chose to help him with medically supervised water-only fasting. And this paper reflects not only his recovery, but 2-year follow-up, where he's maintained his health and his cooperation. This next case report involves a mass that was detected in a patient that was a 66-year-old female who was obese, high blood pressure, hypothyroidism, had back pain, degenerative disc disease, and she'd had this recent onset of intra-abdominal and pelvic pain, swelling, and nausea, despite the fact she'd been on a vegan diet for 14 months. Is a vegan diet healthy? Yeah, it just depends, because a vegan diet just means there's no animal food. So to the degree that there's no meat, fish, fowl, eggs, and dairy products, that's good. But is Coca-Cola vegan? Are Oreo cookies vegan? Okay, so if a person was on a Oreo cookies, French fry, potato chip, Coca-Cola diet, is that a healthy diet? Okay, so she was on a vegan diet, but it wasn't a health-promoting SOS-free diet. But she'd been on a vegan diet for 14 months, so her doctor referred it to us. And they had done a CT scan which showed that she had a mass. It was 4 and change by 4 and change centimeter mass around the left common iliac artery. She'd been diagnosed as having hydronephrosis, proximal ureterectasis, kidney cyst, and malignant neoplasm or fibrosis. They decided they needed to do a biopsy to tell if it was cancer or fibrotic lesion. Either way, they were going to be recommending surgery. So what she did instead was she came to True North Health Center, underwent a period of medically supervised water-only fasting against the vehement objection of her physicians, I might mention. And that was her CT that had confirmed her mass. After a 13-day water-only fast and 11 days of a whole plant foods diet, during which time she experienced nausea, diarrhea, abdominal pain, fatigue, episodic chest tightness. Sounds wonderful, doesn't it? She had what I call an entertaining fast. And by the time we were done, though, her weight had dropped significantly, her blood pressure had normalized, and on follow-up scan, her kidney and ureters were normal. She had resolved her hydronephrosis, and they had to cancel the biopsy because there wasn't enough residual lesion to actually biopsy. Next case is a woman that came to us, referred actually by Dr. McDougall. She was blind. She had Fuchs endothelial corneal dystrophy and was told that she had to have replacement surgery. Dr. McDougall will sometimes send us patients, but he says we're the punishment. He'll apologize to the patient. He'll say, you have this problem. You need to go up there. Good luck. Thanks. So her vision acuity had dropped to 20/200, and she had been tracked. This is for about 15 years that she'd been doing this, and was told that she needed a corneal transplant. So she described it as if someone had put wax paper over her eyes. She was unable to read, cook for herself, walk without falling, or identify people in social circumstances. So it had gotten bad enough now that she wanted to do something really dangerous and radical, and that was change her diet. And she did. And within 15 days of her arrival at the True North Health Center, she started to notice vision improvement. By 4 months, we were able to objectify that change. She had gone from 20/200 to 20/40, uncorrected, and her ocular pressures had normalized, and she has her vision back now. She's also lost 100 pounds and continues to do very well. In fact, that paper has been accepted for publication, I believe, in March in one of the journals. So True North Health Center is, and our affiliated True North Health Foundation is a 501c3 nonprofit research-based organization. We're essentially a research center disguised as a clinic. We do internship and residency training. There's a number of all of the chiropractic and naturopathic colleges. We're an ND residency training site for naturopaths that want to do a year of training postgraduate. Some of the medical schools, including Texas A&M, their functional medicine doctors can rotate for a month as part of their training. If you know a doctor that wants to do something worthwhile in their life and go to heaven instead of hell, you can send them to the True North Health Center. The foundation provides room and board and training. There's no cost to the doctors. And we can show them how to do fasting and how to use a diet to actually get people well. I mentioned last night, for those of you who are here, that I had done a continuing ed seminar in Texas for physicians on the treatment of diabetes. And we presented some of our cases. And afterwards, one of the physicians who said he's been treating diabetic patients all his life, 25 years in practice, he's never seen one get well. Entire career, never seen a patient get, oh yeah, we're routinely seeing people with diabetes normalize their blood sugar, but they have to be willing to make diet and lifestyle changes, and we'll show those doctors how to do that intelligently. If you're interested in the things I've talked about as far as the pleasure trap's concerned, I think they've got copies out here of our book, The Pleasure Trap, Mastering the Hidden Force That Undermines Health and Happiness. Disturbing book, will not tell you what you want to hear, but it will tell you what you need to know to get and stay healthy. And we have 3 vegan SOS-free cookbooks, so books that don't use salt, oil, or sugar, all from Whole Foods. Useful resources for those of you that want to get and stay healthy. I have a few minutes left. If you're interested, I don't know if there's provisions for a microphone, but I'd be certainly happy to take some questions.
Hello?
Yeah, so
Hi,
the question is, what about fasting and taste? What do we think is going on? Well, actually, we kind of know what's going on now because we've actually done a study. It's not been published yet, but it's being submitted for publication this month. And that was a taste adaptation study where what we are finding is that the actual neuroreceptors change. You actually get neuroadaptation. And so your ability to detect salt becomes more sensitive. And so, for example, when people come in and they eat Swiss chard, to them it may just be disgusting. After fasting, they find it's so salty they can really taste the natural sodium that's there. And it's because you've overcome their addictions and their perversions. And I think it's really that simple. You just become better at detecting these factors and your desires. Many of you have noticed if you go on a healthy diet, after a while, the super sweet desserts that everybody craves so much become less appealing. They're just too much. If you eat soup in a restaurant, it's like overwhelmingly salty. But the waiter thinks it's great. So I think we're just seeing a change in normalization of the neuroadaptive mechanisms, and taste have to be included in that.
Please wait for the microphone to ask your questions.
Hi, I have a question about the whole food plant-based way of eating. If one is pre-diabetic, is it okay to do whole food plant-based eating because it has a lot of carbohydrates?
Right. It's only okay if your goal is to actually resolve the diabetes. So,
Okay, for
because
pre-diabetes.
Yeah, so the question is, what about if you're first of all, there's
Thank you.
no, in my mind, pre-diabetes. It's like pre-pregnancy. It's just a various degree of insulin insensitivity. So if you have early diabetes, what you want to do is actually give the body a chance to heal itself. And the problem in diabetes is not complex carbohydrates. The problem is the things that cause insulin resistance, which is excess calories, which is usually from sugar and oil, and highly processed foods. So when you take a diabetic, immediately, if you put them on a lot of fruit or something, yes, you'll see problems with glucose control. You have to actually have them on the diet long enough to resolve the insulin resistance so that then they can tolerate fruit and vegetables effectively. And so what we do is either put them in a plant-based diet and allow that process to happen, usually rather rapidly, or if it's very resistant, we'll use water-only fasting, which will normalize blood sugar levels, and then after fasting, we introduce fruits, salads, and steamed vegetables. And what I'm telling you is the vast majority of type 2 diabetics are able to do that, maintain normal blood sugar levels without medication. So we're able to eliminate the medications and normalize diabetes. In the most resistant diabetics, the type 1.5 diabetics that are no longer producing optimum levels of insulin, sometimes you do have to further refine the whole plant food diet, perhaps to eliminate certainly all processed. We don't use fruit juices and these kinds of more processed dried fruits, et cetera. Sometimes we'll even restrict whole fruit in the diet until blood sugar level control is additionally improved. Some carbohydrates like beans have a lower glycemic response than maybe grains, and so you might use a diet that's more dominant in beans so that they get better short-term control. But understand, long-term control is a whole plant food SOS-free diet, and if necessary, fasting. And so, yes, you may need to modify the diet initially as you make the transition into using large amounts of green, raw, and cooked vegetable materials because those have a much lower carbohydrate count, and as people are losing weight and reducing insulin resistance, that can be helpful for your short-term control. If you want short-term control, just eat meat, right? If you just eat meat, you have no glucose, and so you get a little bit better short-term control. The problem is it makes the diabetes worse until eventually that itself will fail as well.
Yeah, my question is, can you list what do cancer cells live on? I've heard it's only glucose, and earlier in this conference I've heard that it's not exclusively glucose. Could you please list?
What I can tell you is that cancer cells in general, in terms of their diet, have a higher dependency on sugar than healthy cells. Healthy cells have a better ability to adapt to burning ketone bodies than cancer cells do. So in an environment, a ketotic environment, cancer cells have a selective disadvantage. But if the process you go about creating that ketotic diet happens to be high animal proteins, you also have to outweigh the cancer promoting effect of animal protein. And so, now they're starting to modify the diets, trying to eliminate the animal protein that's recognized. It's like gasoline on the fire of inflammation. And so they're trying to come up with more plant-based, higher fat diets. From my viewpoint, you have to look at the bigger picture, not just the one issue, which is one of the metabolic issues involving cancer cells, which might be their glycemic response, but the overall picture of what promotes health. I've already mentioned that I think the real cure for cancer is prevention. And the same things you do to prevent cancer, in my opinion, are the things you're going to be doing to treat people that are already afflicted with this condition.
Yes, I have this quick question. Some people are talking about the difference between being obese, overweight, and the difference between being chronic inflammation, mostly caused by gut leaking or something like that. And what is, if you have any experience or any studies about the implication of utilizing the turmeric to
Well, yeah, I mean, there's a lot of studies that have been done looking at various exogenous agents, and those are all nice. I'm not the expert in pills and potions and powders. That's not the thing that I address, but I can tell you the effect sizes are quite small. If you want big effects, you have to really get out the big guns, and that means diet, sleep, exercise, fasting. These are the foundations of health. The outside agents, some things turn up or turn off various mechanisms. That's all fine. I don't have any problem with those kinds of interventions as a whole, but they pale in comparison to the really big effects. And I think the real danger to them is they distract people from having to take on the real important work, which is controlling what they put in their mouth, making sure they get to bed on time, engaging in appropriate activity, and learning to manage their stress more effectively. If you're doing all those things, in our experience and our results are showing, people are getting so well so rapidly, we don't have a lot of time to sell them all kinds of pills and potions.
Would this fasting be beneficial for people with Parkinson's?
Parkinson's disease is an interesting challenge. We have 2 doctors in our clinic that have been trained by Marty Hines in using his protocol, which involves the use of mucona as a source of L-DOPA and amino acids and supplements as a way of controlling the nausea that's normally controlled by a drug called cardopa. And cardopa has a problem because although it controls nausea, it's the counterpart in Cinemet. It results in some long-term problems that Dr. Hines has documented in dozens of published papers, not the least of which is associated with dementia and other changes that people think is a normal part of Parkinson's, but may really be more about the treatment of Parkinson's. Unfortunately, diet alone is not always sufficient at controlling the symptoms in Parkinson's. So although we combine diet, exercise, balance training, et cetera, we also use this exogenous L-DOPA. And it does work well, and it works well without some of the side effects that come from traditional medication. But it's not a condition that we can treat with diet alone. We do require some outside agents to get the level of control that's desirable.
1, is it okay to water fast if you have amalgams? And 2, if you have cysts or polyps and you're already low weight and go on the vegan SOS, is there a chance of resolving those without the water fasting?
Well, yeah, I mean, the body health results from healthful living. So you do diet and lifestyle change, and oftentimes conditions will resolve themselves. If they don't, then we can turn up the heat a little bit by using water-only fasting. That's why they call us True North Health Center, the last resort. As far as amalgams, amalgams can be a source of mercury, low level of leaching. So I would recommend if you're having new fillings done, there's better materials to use and less toxic materials. I wouldn't take completely stable fillings and recommend you rip them out. You're probably going to get more exposure in that process than you would even from the background exposure. But as far as the reason why some people get better when they've had amalgam fillings removed, it may not necessarily just be mercury, but it's also because old fillings that are breaking down often have decay associated with them, and that's an infection. And so sometimes just cleaning up the old decay can be beneficial. And certainly if you're removing deteriorating filling, you want to replace it with some of the newer composite materials that don't have the toxic thresholds that perhaps the older, cheaper amalgam fillings had.
Yes, how safe is this program for children with obesity and high blood pressure?
Well, it's just the same adaptation in children as it is in adults, and it works just as well. It's just that the one thing with children you always have to be cognizant of is hydration. Small children are much more vulnerable to dehydration than adults are, so the level of monitoring that's necessary is high. It's not something that we recommend doing water-only fasting with children, except in a controlled setting. The good news is kids are also usually not as toxic as adults because they haven't had as many years of abuse, and so diet and lifestyle change alone are usually sufficient to allow the process to turn around. If you can get and induce the necessary dietary changes, it becomes less necessary to go through the more vigorous process of fasting.
Hi, okay. You speak about a 40-day fast, water fast, a 21-day water fast. These are people who have eaten every day, all day. How do you wean, or what do you suggest people, how they can get on this fast, water fast, without stopping it?
Right, so what we do is we have people lead in as much as possible with a whole plant food SOS-free diet, and particularly the 2 days before arrival or the first 2 days at the center, we're eating exclusively fruits, vegetables, raw and cooked, and no meat, fish, fowl, eggs, dairy products, oil, salt, sugar, coffee, alcohol, or anything else. Basically, we tell people anything that you might possibly want, you can't have. You get nothing. And then afterwards, we ask people to comply with the whole plant food SOS-free diet, not forever, just for 50 years. And once we get our 50-year follow-ups, then they're free to do whatever they want. In fact, recently I got a gentleman who came in, it had been 30 years from his original visit. He came in at 55, and now he was 85. When he was 55, he was a carpenter. He had trouble at that time with his shoulder, so he came to see me as a chiropractor to see whether or not I could help him with his shoulder, because he couldn't paint the ceilings. And his kid was in his crew and had to paint the ceilings for him. And I said, well, first you'd have to quit smoking, you'd have to quit drinking, you'd have to give up all your meat, fish, fowl, eggs, dairy products, oil, salt, and sugar. And he said, would I have to do that forever? And that's the first time I said, well, no, of course not. It's just 50 years. And he said, you think you're funny, don't you, Doc? And I said, yes, I cracked me up. But anyway, he did it. He actually quit smoking and drinking. And I worked with him, and it's been a long time, I lost track of him. So finally, he shows up in the office. It's been 14 years since I've seen him. And he comes in for a checkup. And I said, what's wrong? He says, nothing's wrong. He said he thought it was time for a checkup. I said, how are you doing? He said, I'm doing fine. He said, this diet you gave me seems to be working. He said, I'm still working. He's 85 years old. He's still painting. I said, that's fabulous. And he said, yeah, all my crew is dead. And my son is dead. 60-year-old son died of a heart attack, not doing the diet. I said, I'm so sorry to hear about your son. He said, it's okay, I do the ceilings myself now. I said, are you telling me that arthritic shoulder got well? He said, well, not so much, he says, but I got an airless paint sprayer. He made another appointment in 14 years when he turns 99. And he told me that if anything comes up before then, he'd let me know.
Hi, I had a question about all these dietary changes affecting our bone health, for example, scoliosis, hunchback, pinched nerve. Does it have any effect on those type of things?
Well, yeah, that's a lot of different conditions. Some of these problems are mechanical. Mechanical problems will approach mechanically. If you have a broken arm, we're going to get you to do a cast or appropriate reduction. If you have spinal problems, we're certainly not against the use of manipulative therapy and physical therapy and exercise and all of that type of stuff. Where fasting comes in, and it's very powerful, is reducing inflammation. In fact, the chiropractors that work at the True North Health Center, and we have a number of good chiropractors, we joke amongst ourselves that you better treat people right away. Because if you wait till they're done fasting, there may be nothing left to do. Because so many of these chronic pain problems go away before we ever even touch people, just from the reduction of inflammation, the rest, and that type of correction. But there are problems that people have. They get hitches in their giddy-ups, and sometimes manipulative therapy, functional movement screening, exercise, these things that we do externally can be a helpful tool. But certainly they're much more effective in a healthy person eating healthy than they are in people that are toxic waste dumps.
Yes, hello. I'm wondering, everybody says that you need good sleep. Does the water fast help at all with insomnia, depression?
Well, during fasting, it can be a bit disrupted. because your brain changes from burning glucose to burning ketones. And I think your brain is saying, what the heck are you doing? Go get something to eat. And, but after fasting, even chronic problems are oftentimes corrected. People that have sleep apnea, oftentimes the weight reduction and the inflammation reduction is successful at helping them, in some cases, even eliminate the need for their CPAP. Patients that have had many times some of the psychological distress that people experience is because they feel out of control, that they have irritation in their nervous system. And many times that is corrected. So the sleep that comes as a consequence of getting healthy oftentimes is profoundly improved. It's also important for people to know if they want to sleep well, they need to sleep in a cool, dark, and quiet place. They need to set a consistent pattern. It helps to deal with the psychological issues, many of which are aggravated by their poor diet and lifestyle choices. So I'd say that the answer is that indirectly, yes, although again, short term, sometimes those symptoms are even worse, and then long term, they get better. You really have to have a long-term perspective when you're thinking about allowing the body to heal itself, particularly for people that have invested months or years in getting themselves sick. Sometimes it can take a little bit of time for the body to completely heal itself.
Yes, I'd like to ask about the water, particularly the water diet. Is there any particular water? Does it have lemon in it? Is it core water? Is it, you know, is it fresh water, tap water?
We use fractionally distilled water, so it's H2O. So there's no alkalinization, there's no additives, there's no magic. We don't bend the water a certain way. We don't have to use any special intervention. You could also use any highly purified water. You could use reverse osmosis. You could use any highly purified water. It's just that during fasting, people become extremely sensitive. And if you give them municipal water with all the hydrogenated halocarbons and the chlorine, they don't like it, they won't drink it, you end up with hydration issues. So we actually have a lab-grade distiller that takes the water down to just pure H2O, which is essentially what rainwater would be if we had a clean environment for it to fall through. And that's all that we're looking for is actually water. As far as drinking water, again, any highly efficient system would be certainly an effective source for your drinking water. We use distillation because it's probably the most effective, but there's other filtration systems that can work as well.
To follow on that a little more, many people have a hard time just having a water fast. And there's something called the fasting mimicking diet,
yes,
in which you have soup and other things and lower amount of calories. How do you know if you break your fast with something like that?
Yeah, so there's some a wide variety of programs out there, not what I've been discussing today. Perhaps they'll have me come back another time. We can talk about fasting mimicking diets and alternative stuff. That's really not my focus of topic. However, if you're interested, you can go to our website, healthpromoting.com. We have a number of articles all freely available, including our version of an interpretation of the fasting mimicking diet research. I'd also like to mention, if any of you are interested in knowing whether fasting might have utility to you, we do offer a free service. If you go onto our website, healthpromoting.com, download the registration forms and fill that out. It gets me your medical history information. You can call without cost. I'll be happy to talk to you and give you my best insight into whether or not fasting may have some utility for you. Thank you very much for your attention.